Good evening, everybody out there. Hello, and welcome to the show. This is Saturday, 5 o'clock. We're going to be talking about something that is very interesting this time. But before we do that, let me take 5 minutes because I got a lot of messages. And before we start, I want to thank you for your support and appreciation. I really appreciate your appreciation. Thank you very much for all the nice messages out there and the thank you messages that I got. I really appreciate it. Now, let's talk about I got few questions actually repeating the same thing. What do you mean by spiritually induced? We don't understand what does that mean, spiritually induced. Listen, the whole idea of this show is to give you tips and give you heads up on what you should look for and give you health concerning your, health advices, and also whether that is mental, spiritual, or medical. This is what we are doing in this show, and this is our main focus. So let me explain to you what spiritually induced means. Some of us experience sexual vivid dreams. It looks so real, whether males or females. If you are male, you wake up in the morning with ejaculation because you had sexual dream that looks so real. Now, the ejaculation that we have is actually induced by the vivid sexual dream that you had. But if you think about it, was nobody there with you in the bed? No, you were alone. Or as a female, you also were alone. You also have a result of the sexual, the vivid sexual dream that you had. So you had a result, ejaculation or a wet vagina in case of a female, right? So this is induced. Induced by what? By the vivid sexual dream that you had. Yet was nobody there, right? So this is a result. This is a physical result that we have in our hand, right? But was no physical body there. You have not had an intercourse with a physical person, with a human being. Was nobody there. Yet you have a result. So this is spiritually induced. By the same token, we have a spiritually induced psychosis. By the same token, we have a spiritually induced epilepsy. By the same token, we have a spiritually induced mental or physical disease. This is not to say that everything out there is spiritual. No. Let me tell you the story of spiritual so you can have basic understanding. When God created human from Adam, we were created from mud. Adam was created from mud. You can touch mud. You can feel mud, right, in your hand. That's a physical something. You touch it, you feel it. Other entities were created from fire. Can you touch fire? You cannot touch it. Another entity were created from light. Can you touch light? You cannot. It's not physical, it's something that you can touch and hold. But mud, you can touch and hold. What does that mean? Human race is created from a dense material, high density material. Other entities are created from very light, dense material. It's not too dense. You cannot feel it. The more density we have, the more physical we can get, we can touch, we can feel. You understand? So this is something that you feel in your hand. So what does that mean? It basically means that these other entities are shapeless and weightless. They are like energy, basically. You cannot feel them. You cannot feel their presence. You cannot touch their presence. So don't come and tell me, I left money on the table yesterday, and God, wow, we have some spirits that took away the money. Because they don't have this capacity. This is just energy. So I don't want you to be delusional out there. Delusional meaning false belief. You believe something that is not real. No. Let me tell you something else. The human race is far more superior to other entities. This is what God said. because he has ordered other entity to bow for Adam. So but that means this human race is far more superior to other entities. Or at least we know that God loves us the most. That's why he ordered other entity to bow for us. So don't be afraid of them, because you are more superior to them. You are far more superior to them. So do not be delusional and do not believe something that is not real. I'm not saying they don't exist. They exist, but they will only harm you on one of two conditions. You invite them yourself by things you do, or somebody send them to you, which in Africa we know as witchcraft. That is the only two means. Otherwise, you are protected by God from birth. And the closer you come to God, the more you are protected. It doesn't mean if I'm too close to God, I don't get it. No, I get it. But there are means to get rid of it. And not everything out there is spiritual. Like I get another question, very interesting. Can spirits cause a positive pregnancy test in a woman? The answer is absolutely no. Because only if you have sex with an opposite sex, and then you meet the ovulation time, and the egg in the female get fertilized, you have a zygote, and this is, by the way, the subject of our talk this evening. To spiritually induce something cannot cause positive pregnancy test where beta HCG is positive, and you test it at home and you tell me, oh, I was pregnancy positive because I think it's a spirit. It's not a spiritual. When human have sex with a human, this is the only way we can have a positive pregnancy test. What about those vivid sexual dreams? Can they cause positive pregnancy test? The answer is no. The answer is no. So that means they're not real? No, they are real. But we're talking about two different things. We're talking about a body, a human being, and we're talking about another entity. So positive pregnancy test can only happen if you have sex with another human. Can I see something on ultrasound if it's spiritual? The answer is no. Then we need a spiritual ultrasound to do that. But only we're talking about human. When you have sex with the opposite sex and the egg get fertilized, then the egg move through the reproductive system of the female, and beta HCG is secreted into the blood. This is when we can say the pregnancy test is positive and is only human involved. So we cannot blame it on somebody else. Now, we're going to start the session today. I think that answered most of the questions that I have got, and I didn't get time. Anyway, if you have a question out there, my WhatsApp is there, 694-94-0172. And today's topic, we're going to be talking about female reproductive system. We're going to give you some, heads up. We're going to give you some tips. We're going to give you some things that you mostly ask about and you have no answer. So we're going to summarize this next 40 minutes or so, talking about this only. So please, if we can play the first video, so we can comment on it, please.
Fertilization is the epic story of a single sperm facing incredible odds to unite with an egg and form a new human life. It is the story of all of us. During sexual intercourse, about 300 million sperm enter the vagina. Soon afterward, millions of them will either flow out of the vagina or die in its acidic environment. However, many survive because of the protective elements provided in the fluid surrounding them. Next, the sperm must pass through the cervix, an opening into the uterus. Usually, it remains tightly closed, but here the cervix is open for a few days while the woman ovulates. The sperm swim through the cervical mucus, which is thinned to a more watery consistency for easier passage. Once inside the cervix, the sperm continues swimming toward the uterus, though millions will die trying to make it through the mucus. Some sperm remain behind, caught in the folds of the cervix, but they may later continue the journey as a backup to the first group. Inside the uterus, muscular uterine contractions assist the sperm on their journey toward the egg. However, resident cells from the woman's immune system, mistaking the sperm for foreign invaders, destroy thousands more. Next, half the sperm head for the empty fallopian tube, while the other half swim toward the tube containing the unfertilized egg. Now, only a few thousand remain. Inside the fallopian tube, tiny cilia push the egg toward the uterus. To continue, the sperm must surge against this motion to reach the egg. Some sperm get trapped in the cilia and die. During this part of the journey, chemicals in the reproductive tract cause the membranes covering the heads of the sperm to change. As a result, the sperm become hyperactive, swimming harder and faster toward their destination. At long last, the sperm reach the egg. Only a few dozen of the original 300 million sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, they attach to specialized sperm receptors on the surface, which triggers their acrosomes to release digestive enzymes, enabling the sperm to burrow into the layer. Inside the zona pellucida is a narrow, fluid-filled space just outside the egg cell membrane. The first sperm to make contact will fertilize the egg. After a perilous journey and against incredible odds, a single sperm attaches to the egg cell membrane. Within a few minutes, their outer membranes fuse and the egg pulls the sperm inside. This event causes changes in the egg membrane that prevent other sperm from attaching to it. Next, the egg releases chemicals that push other sperm away from the egg and create an impenetrable fertilization membrane. As the reaction spreads outward, the zona pellucida hardens, trapping any sperm unlucky enough to be caught inside. Outside the egg, sperm are no longer able to attach to the zona pellucida. Meanwhile, inside the egg, the tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads, called microtubules, pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia in the fallopian tube gently sweep the zygote toward the uterus, where he or she will implant in the rich uterine lining, growing and maturing for the next 9 months until ready for birth.
So that was a good introduction on how things happen. As you see, the male has not much role to play in this except for the sperms. So let me go over the male issues that we can commonly find that concern with infertility. The male gives the sperms. Once the sperm is ejaculated into the vagina, the sperms knows what to do. You see, the sperms goes from the vagina through the cervix, to the uterus, to the fallopian tubes. And then once the egg is kicked out of the ovary, they go to the fimbria, a place between the tube and the ovary, and fertilization happens there. And then the journey continue back all the way to the uterus, where the zygote implants. That takes about, in day 7, 5 to 7, the implantation take place. And once the implantation take place, the function of this zygote now is to dig in. They're looking for food. They dig in into the wall of the uterus looking for food. And their food is actually the blood supply. So once they get into the blood supply, a hormone called beta HCG is secreted into the blood about day 9. And this is when you can test for positive pregnancy test. That's how it happens, and this is how the journey happens. Now, let's talk about infertility. The man has a very small role to do. The man gives the sperms. The sperms know what to do, and they do the job. So the man can have a problem with the sperms, either with number. The number is not there. You heard in the video, we need 300 million, about 300 million. 150 million will do. 150 million. So either the count is low, or either the functionality is not there. The performance of the sperm is not there. The sperm is deformed. When we're talking about numbers are not there, we refer that to infectious causes. Most of the time, the area, the environment where the sperm is made is not suitable for the right production of the total amount. They get killed because of the bacteria, because of other things that has changed the pH, which is the environment where the sperms lives. Another condition that can affect the sperms is the variceals, is the dilated veins. We're not going to talk much about medical terminology, so we'll make it simple. When the veins in the testicles are dilated, that dissipate more heat. See, when God made the testicles in the scrotum outside the body, it was for a reason. Why? Because we do not get the sperms exposed to normal body temperature. So it has been made to sit in a scrotum outside the body, which is about 1 degree less than the body temperature. So if you have dilated vein in the scrotum, that will dissipate more heat, that will not be favorable for the development and the full growth of the sperms. So that's why we can have a decreased number and or decreased functionality. So we mentioned 2 things. Infection can affect the number and functionality as well. Extra heat coming from extra dilated veins in the testicles can also affect the number and functionality of the sperms. I got a patient about a week or 2 ago. He has been diagnosed, he done the spermogram. We do something called a spermogram, where we can tell you the number and the function of your sperms. So this guy has a spermogram that shows 0 sperms. So somebody recommended him that he goes to such and such village and get those herbal things, that concussion that they made, spending hundreds of thousands. And after almost 1 year, he comes back and he said, do me a spermogram. We do the spermogram, still 0. We do the ultrasound, we do the physical examination. The testicles are very small, very small. So this guy, unfortunately, had what is called primary hypogonadism, meaning there is no way you can have sperms. No way you can have sperms because you're not making them. There is no testicle tissue to make the sperms. So do not waste your time and money, because that's what it is. You don't have the factory that makes the sperms. So this is the extreme. Other causes, whether it's dilated veins or infectious causes, that can easily be dealt with. If the numbers are low and we need to stimulate the production of the sperms, there are injections. And let me talk about those herbal treatment. And it's very sad. I seen during my practice years, young girls, Let me just say something. Please do not call me because I will not be able to take calls. Just, the number is there on WhatsApp. I want you to just send a message on WhatsApp. So if you've taken some herbs or something from somebody who is making wudu, all my respect to everybody out there. I'm just giving advice. I see in patients, young girls, young boys going to dialysis because of things they take. They put in their mouth and they don't know what it is. If you want to take a herb, know the source, where is it coming from, what its name, and investigate, is it good or bad. Most of our medication today is coming from herbs, I agree. But we know the dosage, we know the effect, we know the side effect, we know when it's harmful, you understand? We know which one causes failure in the liver or failure of the kidneys. We know which one is toxic to the brain. We know, we studied them. That's why they have pharmaceutical companies making medication, because we know. But when you get me something from the forest and tell me take this because you're gonna get pregnant, come on now. Or you're gonna, that's something, you know, if you do not, and the way he prepare or she prepare this concussion or that you take in with your mouth, do you know how sterile it is? Did you know if it's fermented or not? Do you know it has bacteria, deadly bacteria or not? You don't know. So please do not put anything in your mouth unless you're sure of the source. Okay? Unless you're sure of the source. That's all. Now, let's take 1 minute break and we'll come back. Okay, now, so we know the male disorder. They only have to do with the sperm. We fix the sperm, you know, number and functionality. We are good. So the male has a lot less to do with the fertility process. I mean, it's easy to take care of. The female is a bit more complicated because we have to deal first with the vagina. The vagina has to be suitable for the sperms. The pH, the environment of the vagina has to be okay, so not many of them get killed, especially if we have less number than the 300 million or so. Now, the sperms has to pass through a canal called the cervix, and this cervix at this time has to be very thin mucus, almost watery, to allow the passage of the sperms like we have seen. So if we have a problem in the cervix has to be evaluated to make sure it allows the passage. Now after this, the sperms goes to the fallopian tube. So here we have another problem. We have another issues here in the fallopian tube. The fallopian tube could be occluded. And one could be occluded, one maybe not. So partial occlusion or full occlusion, then we have to investigate. If you have a good ultrasound out there, you can see without the need to push dye and go through invasive process of HSG. But if you have a good ultrasound machine, you can see if the fallopian tube. Now, the fallopian tube is a problem. So we know the cervix could be a problem, thick mucus that does not allow the passage of the sperms. The fallopian tube could also be a problem whereby we have what is called adhesions. Adhesion meaning is like a spider web, like this spider web that you see out there. The same thing, imagine the same thing happening inside. And now we have the fallopian tube right here. We have inside the fallopian tube, we could have adhesions that looks like a spider web, or outside the fallopian tube, we could have the adhesion. Outside is easy to deal with because we can go with laparoscope, you know, and then we cut those adhesions and you'll be fine. But the problem is with the internal adhesion. So what is the cause of the external adhesion? If you have previous surgery, that can cause adhesion and compress on the fallopian tube, the sperms cannot pass. If the sperm cannot pass, you cannot get pregnant. Now, what is the cause of the internal adhesion then? Chlamydia. Chlamydia causes internal adhesion of the fallopian tube. And that is the most common cause that is easily treatable and preventable if you take care of yourself. Meaning, be careful. And do not tell me, I seen during my practice that, young girls, for 14, 15, because I use public toilets. There is no public toilet that give you chlamydia. It's only sexual intercourse that can give you chlamydia. Okay? So sometimes people lie to themselves, and they lie so much, and they're so convinced with the lie that themselves they believe it. And then they convince their family that this is what happened, is from the toilet. So no. Let me tell you something. Chlamydia come only from sexual intercourse. It's an intracellular, organism that lives inside the cells. It can only come from sexual intercourse, among other diseases, of course. But chlamydia is the most common cause for infertility. So if you're looking for a baby, make sure you don't have chlamydia. Because chlamydia, with time, it causes internal adhesion of the fallopian tube, the way the sperm takes to get and fertilize the egg. Now, we've spoken about chlamydia. Can I get pregnant on top of chlamydia? Yes, we're going to see a case right now. You get pregnant on top of chlamydia. I mean, she didn't know she was pregnant. We done the ultrasound. We see that she was pregnant, and then it's there. Now, let me start now to tell you when can you get, a window of opportunity to get pregnant. Most of us out there do not know how to calculate the ovulation day. The ovulation day is very easy to calculate. First of all, your menses, that is day one. No matter how long is your menses, 1 day, 2 days, 1 week, 100 years, I don't care. Day one of your menses is day one. And you count this now, 1, 2, 3, 4, 5, till you reach to 14. In that 14 day, that is your ovulation day. So menses considered as day one. You count 14 days, and then that will be your ovulation day. So when is my window of opportunity to get pregnant? Day before, day of ovulation, and day after. What I do there, do what you do, have intercourse, sexual intercourse, to hit the window of opportunity, and you'll get pregnant, assuming that everything else is okay. So to calculate my ovulation day, I do look at my menses, that is my day number one. I calculate 1, 2, 3, 4 till I reach 14, that is my ovulation day. Regardless of how long is your cycle, whether 21 days, 28 days, God knows how many days, it doesn't matter. It's always day number 14, counting menses as day number, first day of the menses as day number one. That is easy to calculate. That is very easy to calculate. Now I want to play some problems that can happen now with pregnancy. Did pregnancy always happen in the uterus? The answer is no. Let me play one of the videos. I think number 2, please. Okay, this is just an image. Now, this is a lucky lady. She missed her menses. She didn't have her menses. I usually, when I do the consultation, I run an ultrasound always. Always, I run an ultrasound. Ultrasound can tell you a lot of things that you can never expect. So this is a lady that missed her menses a couple of weeks or so. So actually more than a couple of weeks. And we run the ultrasound and we see this empty space there. Empty space with that circle there, that means congratulations. The pregnancy is intra-uterus, is inside the uterus. And that circle there represents the neural crest, which is, we call it the fetal pole. That means this is a good pregnancy. What we need is to follow up and to see the progression of the growth and the development of the baby. Let's move to the next image. Okay, this is another case that I would like to discuss with you. That's another patient. And this, in the top there, this is the uterus. Beautiful. And you see the same thing, gestational sac in the uterus. Beautiful. But what do we see there? I put the color Doppler just to show you. Color Doppler meaning the technology inside the ultrasound machine that can lead red or blue, indicating this is a blood vessel. But see, this black at the bottom there is no indication as a blood vessel. That means this has to be fluids. And when we have fluids under the uterus, that represents inflammation. And inflammation comes from infection. So that lady got pregnant on the top of an infection. And guess what? When we ran the test, chlamydia especially, chlamydia came out positive. chlamydia came out positive. So we have to get rid of the chlamydia, because chlamydia is a problem. Even if you continue to have chlamydia at the time of birth, the child can come blind, because chlamydia can affect the child eye, because he has to go through the birth canal that is infected with chlamydia. So chlamydia has to be taken out, has to be treated, and the treatment is easy. The treatment is very easy. All right, we'll take a minute break and we'll continue, inshallah. All right, let me answer this question quick. I have a message. He said he's a pastor for the last 14 years. His wife cannot get pregnant. He feels movement, little worm moving in my urethra and bladder. My wife has hormonal imbalance. We need to check this out to see if it's really true or not. And, how can we handle this situation and have a child? Well, this sensation of things moving in the urethra, that's a sign of infection. That's a sign of infection. So the first thing, we check you we do infectious profile, and we see if there is any infection or not. This is the most common cause, and that is the easy way to find out if there is an infection or not. This is number one cause to prevent pregnancy. So it's very easy. Please, run an infectious profile, and then we can take it from there. So I have another one, but let me take them in a few minutes. Okay, now, so this is the situation here. This is the situation here. If you get pregnant in the tub of chlamydia, you're lucky, because maybe chlamydia has not been there for a long time to do the internal adhesion in the fallopian tube, like we have discussed, and you get lucky. So pray. So second thing, is easy to prevent chlamydia. Before you have a sexual relationship with somebody, can you please check yourself out and check your partner out, so at least you'll be at ease. I'm going to tell you a story that happened yesterday, a small story. I have a man, he's my client, my patient for years, since 2014 or so, since I started coming to Cameroon. I'm Egyptian, by the way, so I live in Cameroon for 7 years, and Cameroon is my country, so I'm also a citizen of Cameroon. So, I'm a Cameroonian just like you, just the skin color is a bit lighter. So, this guy came, and he's a friend of mine, he's a patient, he's an old patient, and he said, I get married, this is my new wife. The lady looks very nice. You wouldn't believe. When we're in the test, she's HIV positive. So I asked him, how many times have you had sex with her? 4 times. You're lucky. It's God who made you come here today. Stop old sexual relationship, and you come back after 3 months. And I need a viral load in the lady and a CD4 count to see how advanced she is, because this is how HIV works. The viral load has to be high up so much before it spills over to the semen or the vaginal fluids. Which one is easier to catch HIV, a male or a female? A female, because of her nature, her anatomical nature. She is a recipient. A male is a bit difficult to catch HIV. So the female is much easier. And now it depends on the viral load. If the viral load is high up in the blood, it can spill over to the semen or to the vaginal fluid, and now this patient is contagious. Can give it to you. What is the chances? 1 over 250. That means I can get it after 250 times that I have sex? Yes, or you can get it from the first time. If you have laceration and blood contact happen. How do you know? I don't know. So what is the best way? Use protection before you have a long-term relationship with somebody, or a short-term. It doesn't cost much now. Do the hepatitis, sexually transmitted, hepatitis B, sexually transmitted, chlamydia, venereal diseases, syphilis, HIV. what? And you have a peace of mind. You have a peace of mind. Otherwise, you know, you're going to go through a very hard time, especially, you know, I don't want to go into it. So, let me play the next video. We're very much running out of time. Let me play the next video. How are you? What are you feeling?
I feel fine.
Okay, that's good. I'm talking about the complaints. I'm happy that you feel fine. What is the complaint?
The complaint I have is no period
Since when?
since, I think, November.
November.
Yeah.
That is how many months now?
4 or 5 months.
4 or 5 months. So you have no menses for the last 4 or 5 months.
Yeah.
Not even the spots.
Nothing.
You didn't notice anything.
Nothing.
And then what?
And I had a miscarriage, I think, December 9th.
So how are you gonna have miscarriage without seeing any blood?
Well, actually, I did see blood.
So you did see blood. So it's
Yeah.
not since November, it's
Not
since December.
November,
Now.
since December.
Okay.
So since December, no period.
So since December is no period. So how many months now?
3.
3 months. Okay.
Yeah.
Or you had another miscarriage after December?
No.
All
I haven't had
right.
any.
So the last time you think it, how do you know it was a miscarriage?
Because I went to the hospital.
And they told you it was a miscarriage?
Yeah.
They confirmed it was a
I
miscarriage?
confirmed it.
But they told you how old was the pregnancy when you had a
It
miscarriage?
was just, I think, 6 weeks.
How do you know? They seen? They seen with ultrasound
Well,
before?
they saw it with an ultrasound.
Ultrasound before you had the miscarriage?
Yeah, before.
So you went to the hospital before the miscarriage?
Before the miscarriage.
And they told you is the baby is 6 weeks?
Yeah.
And then you went home and you had a miscarriage?
Yeah, I went home, had a miscarriage.
Okay.
Went back, did another scan.
Focus only on the screen. All right, so let me see. Now we have this patient, okay? We have this patient, and we have a very interesting case. She been 3 times for ultrasound, and they told her that she is not pregnant. Yet the pregnancy test is positive. So that's a very unique case. Now, we look here, the minute I put the ultrasound, I see what? I see ectopic pregnancy right there. Right there, looking up in the face. How can somebody miss it? I do not know. But anyway, this is what we see. There's a very large ectopic pregnancy, and this is the gestational sac. Where is the pregnancy? Here, we put the colors to be 100% sure, and what we see here is what? Is the external iliac. That means this is the ovary. So that makes it ovarian pregnancy. And look here at the pointer. Look at the pointer here, and this is the pregnancy, and this is actually the pregnancy right there. Now, the next step we're gonna do is to measure. We're gonna measure how big is this sac. Now, we gotta measure this sac here, and in a second, I will tell you how big is this pregnancy. Now, the sac is measuring. We're still measuring. And here is the measurement, approximately 37 mils. 37 mils, and we see the conception remnant right there. That could be the placenta. Do we see a fetal pole? I do not see, but if we look closer, we might do. Stop. See where it is, but this is a case that most likely we can refer to. So we did measurement on this sac, considering it's probably a gestational sac, and most likely it is, and we measured it, and come and look at the screen here. Okay, look at it. This the screen here, and it measures what? Gestational age, 10 weeks and 0 days. She's already 10 weeks pregnant, approximately 10 weeks, based on the size of the gestation, which is now, we're talking about ectopic pregnancy, and like you said, what, it can go up to 12 weeks, right? It can go up to 12 weeks. So we got only 2 weeks. I don't know. Now the management in this case will be either methotrexate injection, 1 milligram per kilogram at day 1, 3, 5, and 7, or we can go surgery and remove it. So we'll discuss with the patient and see what it is. But this is a case that most likely we can refer to a specialist, or we can manage with methotrexate and see the consequences. So this is here we are at risk for rupture, ectopic rupture. This is ovarian pregnancy. This is the external iliac, and this is the ovaries, and this is the sac right inside the ovary. Thank you. All right. So let me discuss this case quick. So as I think I discussed everything. The case is still, so this lady here, she got positive pregnancy test at home. She went to other clinics, she got a positive pregnancy test, and some of them say, okay, this is a cyst. It's not a cyst. If you have a positive pregnancy test and something is swelling there that is not inside the uterus, that's by definition ectopic pregnancy, and that can rupture, and this is an emergency. So what you have to do, we have to do one of two options, either injection if the pregnancy is safe, like 6 weeks or so, we use an injection for a medication called methotrexate, day 1, 3, and 5, and 7, or we can just go inside and remove it. I don't do surgeries. I refer her to some of the good doctors. The Cameroon has very good doctors that can do this very successfully without a problem. I got one more question here. I'm going to answer that quick. Now this here, I have not been able to conceive. I'm 45 years old, and I have one of the fallopian tube, with one only fallopian tube. Can I still have a chance? Yes, you can have a chance, because this is how it works. One ovary ovulate 1 month, and the other ovary ovulate the following month. So it's like going to be, okay, my ovulation, we don't know which one is which, but a doctor can tell you, because once we put the ultrasound, the ovary that will ovulate will have a small cyst, about 2 millimeters or so, 2 mils like this, 2.5 or so. That means that's the ovary, you're going to ovulate from this ovary. So the side that you know that you don't have a fallopian tube, you just have to skip this month and go to the next month. Okay, so you, again, 1 month you ovulate from the right, the next month you ovulate from the left. If the right is gone, you still have a chance to ovulate from the left. I have a few more questions, but if I don't know if the production can allow me a minute or two to answer them, will be great. Will be great. Yeah, this man here is very much the same thing, but he's a man. He said he has lost one of his testicles during an operation, and he has only one testicle. Can he still conceive? The answer is yes. The answer is yes. He can still conceive, is no problem, because what one testicle does, the two testicles can do. If we eliminate one, you still can, can take another, can do another one. But hernia doesn't. What the hernia got to do with the testicles? If you have an inguinal hernia, they push the hernia back and they suture and they fix, and they don't touch the testicles unless there was something wrong with the testicles. That's why they have removed it. But the hernia has nothing to do with the testicles, my friend. It's just hernia that drops inside the scrotum and can cause strangulation, meaning a lot of pain. You cut the blood supply for that pieces of intestine. You just have to push it back, suture up, and if you have to do some mesh or something so nothing can fall down again, and that's it. But unless the testicles are bad, then you will have to remove it. But the answer is yes, you can conceive. What one testicle does, the same thing two testicles can do. So you can live with one testicles, you can live with one fallopian tube, the same way you can live with one kidney. Is not a problem. It's not a problem. We still have a chance. There are more other questions, but I think we'll end up here. I think my time is up. Thank you very much and for listening to me, and I will see you, God willing, next Saturday at 5 o'clock. And if you have any questions that I have not answered, please, you have my WhatsApp, 694940172. You can send me your question, and I'll be more than happy to answer you and help you as much as I can. Thank you very much out there. Have a nice weekend, and God bless you all.